For the first 4 years, I did not know another human being with hemophilia or a parent like me. I wish I had that community, and that was my motivation.
Welcome to Where Hope Begins, the Save One Life podcast, one country, one community, and one life at a time. I'm your host, Kai, and today we're joined by Maureen Miruka, the founder of the Jose Memorial Hemophilia Society of Kenya, a leader whose story is rooted in love, loss, and a decision to build a community of care, advocacy, and hope for families living with bleeding disorders in Kenya. Welcome to the podcast, Maureen.
Thank you, Kai. Yeah, looking forward to it.
Absolutely. Let's just start out by telling our listeners who are hearing from you for the first time, what's your story and who's Jose? Who was Jose to you?
Great. Maybe I'll start with the last question, that Jose. And by the way, in Kenya, we tend to say Jose rather than Jose, but being in Mexico again, so that is mixed up a bit for me anyway. So Jose was my son who I lost to hemophilia when he was 6 years of age in 2007. He was just shy of his 6th birthday, and just our experiences through his short life and passing on were the motivation for beginning the society. At that time, I was very clear about just letting his death not be in vain. So I'm also Ethan's mother. Ethan is 18 next month. He also has hemophilia A. I am a gender scientist and specialist. I work for the International Center for Maize and Wheat Research based out of Mexico. And then what I do, of course, with the Hemophilia Society is to provide that leadership, and I'm its founder, as you've already mentioned.
Well, thank you for sharing, and he's so sorry for your loss. And I guess going back to those early days with Jose, what was life like when you were first trying to understand what was happening?
Yeah, so you know what happened? One time, actually, Jose nicked his finger. He was about 9 months of age, and it would not stop bleeding, and we went and saw a pediatrician. Then I lived in upcountry in a place in Kenya called Kisii, which is where I was born and brought up. And the doctor thought that amount and length of bleeding was rather curious. But before that, he had had a few bumps, on his body. And checking with the doctor, they were like, maybe because that was it is a malaria-prone area, maybe this is a common reaction that we see on sulfur-based drugs that we treat malaria on. Maybe it's an allergy to eggs. And we went through all of that. And that's, of course, when he, like all children, when they start crawling at around 6 or so months of age, and you see these bruises and bumps. And then another time he beat himself while breastfeeding. I did breastfeeding for a long time, and the bleeding would not stop. And so the doctor was like, this looks like hemophilia. You need to get into a bus. Back in the day, that was about 7-8 hours on the road, and go to Nairobi and try to get it diagnosed. So, of course, we arrived in Nairobi with blood all over. He's still, breastfeeding. He was already so low on blood and iron, and got admitted into hospital. And that's when a very difficult journey of diagnosing the condition started, because back in the day, they did not even have the reagents unless they were teaching the course at the university for testing. So we had to get samples around 3 times, which got messed up, to be sent out of the country for testing before he was finally diagnosed with hemophilia. So just looking at that, first of all, you wish that there was care close to where we were, that we did not have to take long bus rides, which some people still do, by the way, to go for treatment. We wish that there was earlier and easier diagnosis, which to a certain extent is still true of the situation in Kenya and developing countries. And then for the first 4 years, I did not know another human being with hemophilia or a parent like me, knowing that it is a very rare condition, 1 in 10,000 boys. I wish I had that community, and that was my motivation for beginning the society, just to find that community in the first place.
Yeah, and again, the story is so familiar, the very long bus ride to find care, the lack of community in those early days with the diagnosis, and really, I guess, how you turned grief into purpose. So I guess tell us a little bit about how you ended up founding the Jose Memorial Hemophilia Society of Kenya. What was like the very first thing you did?
Yeah, so what I have described then became, my life in terms of living up country, going into the city for treatment. And I began to feel that something needs to give, something needs to shift over here. And one of the times when I had gone to the Kenyatta National Hospital for treatment, I met one of the doctors there introduced me and said, there is another lady here who also has a child with hemophilia. There was a Kenyatta Hospital Association in which back then, which is not the case right now, that was largely led by medics and was trying to bring people together. So that for me it was such a relief to know, one initially, and then two other people who are parents of children with hemophilia. We were raising similar kinds of issues, me and this gentleman who then became my partner in crime, as I would call in the society, Kehio Chege, and we kept raising that we need to have a parent's view or a patient view to this organization, and how can we really bring those issues back. But then at around that time, I lost my son. And there was no turning point in terms of this has to change. So I had that drive that we needed to be heard as parents. We could not have lost him if 1 or 2, 3, and 4 things were in place. We needed a community like this. So in losing him, then the people that I had already met, came around me. We went through his funeral and all that. And after that settled out is when I received a card, because one of the ladies that I had met at the Kenyatta National Hospital had already met with Lori, who had attempted to come into Kenya way before, this time, and tried to make inroads, but was not able to. And so she had told her about me, that I was trying to, to get hemophilia organization started in Kenya. And so she sent me a card to say, of course, to share her condolences about losing my son. And I kept that card with me for a very long time, because then we kept in touch and said, you know what, there is someone like me who's making this change around the world. When you have that unity of purpose, then we began conversations with Lori. She shared her book on being a hemophilia leader, and there it began. So we got 4 of us parents together. We went into this cafeteria of the hospital where Jose died, and we began.
Yeah, thank you so much for sharing all that. And, I think what's familiar to me is Maureen found someone like you who wanted to make an impact. Tell us what it's like living with a bleeding disorder in Kenya, and how do your organizations come together to help those families?
Yeah, so as you say, meeting Lori, and then we invited her to Kenya, and she came, and we would do outreach, go out and meet hemophilia families and see what it is, day to day, step into government offices at the Ministry of Health and try to bring hemophilia up into the agenda of the government's priorities, and just doing a lot of that advocacy and awareness, going out into the media, both print and electronic, on TV, and just talking about hemophilia and getting people to know about it and to sign up. This was such a huge step of faith, because we did not even know what kind of support are we going to offer these people, but we're like, can we get together first, to get the numbers up so that we can make a case. But then Lori had also founded Project Share. They were sending still send medicine to developing, countries. And that was one of the initial programs we began at Save One Life in terms of getting the medicine before we went on to the other programs, which I think we're going to talk about as we move along.
Yeah, absolutely. How are you making a difference in people's lives in Kenya? And part of that was this Project Share that distributes Factor safely to these families. What other kinds of programmings, maybe in education or mental health, do you provide for families to help support?
So after we did the medical in terms of getting Factor from Project Share, I like to say we are, even where we work, we are human beings first, before we are workers. So it became quickly apparent that we needed the support groups. For me, that was very important for mothers to get together, for fathers to get together, for boys with hemophilia and siblings to get together and just have conversations on what helped, what worked, and how do we support each other. But then it also became apparent that these children were not performing as well in school as others because of absence, distances to school, bleeds, going to school, without shoes sometimes or without transport, and you fall down and, and long absence, they were not doing as well. And so we began, for those that had completed high school or dropped out of high school or just got into college, micro grants to make sure that they were economically, empowered, that they could earn a livelihood and earn a living out of the enterprises they did. We had, I think, I remember Simon, who had a cow and still keeps his cows up to now, and he was married with children. We had someone else who began like a shoe, business. Another one began a clothing, sales line. Really, those kinds of things which are not as others as farm labor, which is where agriculture is the biggest employer of rural, families in Kenya and in the developing world. And so ensuring that they got those grants for them to have some almost gainful employment. And then again, very close to me and very dear to what I do is considering the women's empowerment element of it, because women remain the primary caretakers. I was in formal employment. My son's father is in formal employment. But if we had to get admitted into hospital, it was me as the mother taking absence of work and staying in the hospital. So that burden on caregiving for hemophilia, it's very disproportionate towards the mothers. And so we also wanted to get them the micro grants so that they could also earn a living and something that was easier for them to do at home. So, chicken keeping so that she's close enough to take care of her child and earning money as well. And then we have very sharp children, hemophilia children. They're very active. They keep getting injuries, but they're also very sharp. And so we got into the education program in getting scholarships for those that come from the families that can really not afford, to pay for their education. Aside of the mothers, we also have grants for a few fathers that are really the breadwinners of the family in supporting. So we have one at the coast who's into a tailoring business, ensuring that he gets the machines and the supplies to provide for his family. And then finally, the cash transfers. They say cash is king. And it gives dignity to families when you give them a stipend and an allowance, a monthly one, so that they can prioritize some of those needs.
You've shared so much in terms of the impact that a sponsorship can have. It's beyond the medicine that's needed. It's the travel to care. The idea that you're able to help someone start a small business so that they can support their family. I think what maybe gets lost on like sponsors and what it means to sponsor, especially I think in a country like America, is how far, a $20 American dollar sponsorship can go in another country. And it's just so impressive to hear that it's not just the medicine, it's also the education, and it's the travel, it's the putting families in positions to be able to support themselves.
Yes.
And it's just really, it's incredible work. And so when you think about the work you've done in Kenya, maybe going back all the way to the beginning and how you're connected to Save One Life now, what do you feel is the biggest maybe difference in the impact you've made, and what gives you hope moving forward?
Yeah, so it's all of that. It's just children living a normal life. Like I lost my son, as I said, just shy of his 6th birthday. It was very difficult then, but one of the things that really stuck with me, that he had a near normal life, despite that. As a parent, that's what you want for your child. It's very difficult because you wish you would take that pain off your child and hold it for themselves. And so ensuring that children are not writhing in pain because they have knee bleeds and all of that, they're able to go to school and play with other children and go on with their education, and that you remove a lot of that worry and stress from their parents. I remember one lady sharing with me is like, I can finally dress up and turn up for the meeting. I had to go to the hospital at night, and my neighbors were always wondering what I'm up to, leaving my place at night. But now I can stay over here. And you can just tell that the mental health, elements of that. And then people just being you don't empower people, they quite empower themselves through the decisions they make, and they have the agency to make those decisions because they have the access to the financials, to start up a business and all of that. We started with boys who are very young, who are my son's age right now, because my son is 18. And now they are young people with families and wives and children and turning up, just seeing that whole human being. I remember for some of them, you went and first saw them, they were on crutches. Their parents did not even understand what the condition was. They just know that I lost a child to this kind of a thing. He had severe headaches and died. So then you realize, that was a head bleed that they actually had. And now they have another son with swollen knees, with crutches. And now they're into factor. They have got physiotherapy. They know what is happening. They know where they can go to help. And now they're walking around, and then they have got married. Some of my favorite is receiving wedding invitations.
Wow, that's got to be so fun for you.
Oh my goodness, yes, Yeah.
Well, thank you so much for taking time. I know you've been traveling so much, and I think you were in 4, maybe 5 different time zones over the course of a couple of weeks when we were chatting.
Yes.
So, but we
Yes.
made it here, and now you're in Mexico. So tell us a little bit about the work you're doing out of Mexico.
I'm a gender specialist. I work right now for the CIMYT, which is CIMMYT, but that's the Spanish acronym for the International Center for Maize and Wheat Improvement, although we do work on other crops that are not necessarily maize and wheat because of all integrated systems and the challenges that we face now as climate change. So within CIMYT, I'm the Director for Gender Equity, Youth and Social Inclusion, where we are ensuring that we reach everybody appropriately, whether they're men, women, young people, marginalized communities, or indigenous peoples, with the right tools and approaches. And just like I have been saying, that they actually benefit from this. They tell you that we have increased incomes, improved livelihoods, better nutrition. We can take our children, to school. But very, very important that they have that agency and decision making, and they can influence processes by service providers, the government, and all of that. And even within the households, you will not believe it, Kai, that sometimes a woman is even considered as a laborer in her husband's farm. She cannot make decisions on what seeds or what variety or what crop, to grow. So just ensuring that we look at those gender dynamics, within the household. But most importantly, that we transform systems. And that is also very, very, very important in the work that we do for hemophilia, in terms of ensuring that the governments include hemophilia as one of the, the conditions in the essential list of diseases, the essential list of medicines. So those systems are transformed to support. So that's what I do for a living. I think what I do at the society has influenced who I become at my work, and what I do at my work has also influenced what we do at the society. Yeah.
It sounds like you're very busy. As a leader, how do you balance all that? What makes you get up in the morning?
First, I think it is that the purpose, being very purpose driven, and it's something that you're passionate about. It is something that life has handed to you and that you can do nothing about. If you truly believe in being the change that we want to see, around the world, and being a key player in effecting that change and carrying others with you as a leader, just living that value-based life and say, I'm really for excellence and integrity in what we do, and this is how I want people, to turn up at work. But what might prevent people from turning up in that way? How do we continue to build the next crop of leaders, both in the hemophilia space in where we are? How do you mentor people? How do you handhold them? Laurie mentored me into hemophilia world and care, and handheld me and provided support, came to Kenya every year and did all of that. How do I pay it forward? Yeah. Into the next community, and how do I how do we just continue that, virtuous cycle, and ensuring that for me, it's a whole issue of justice, like social justice.
Yeah, absolutely.
Yeah.
Well, thank you so much for your time, for being here today, and just thank you so much for your time.
You're most welcome.
To learn more about Save One Life and how sponsorship transforms lives, visit saveonelife.net/sponsorship. And if you'd like to help share the mission, please follow the show, leave a review, and send the episode to someone who believes that dignity and opportunity should never depend on geography. Thank you for listening to Where Hope Begins, the Save One Life podcast. One country, one community, and one life at a time. Thank you for listening to Where Hope Begins, the Save One Life podcast, because when one life is supported, generations can be transformed. Presented by Save One Life in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send me an email at kai@balancinglifesissues.com. Did today's story move you? Sponsor a child at saveonelife.net/sponsorship. Anything else to add, Miles?
Yeah, Dada.